So you see the two pictures. We have made a radiograph before surgery and after surgery. And as you see in these two radiographs, the position of the hips have already changed. So as you see, I will paint with here the lines were showing together, and now they are nearly straight, parallel. So especially the left side is more abducted. And I color with green. The physis that is here was not parallel to the acetabulum that looks like this. And now on this side, this and this is nearly parallel. So it has improved a lot, which means that the growth of the femoral head is now towards the acetabulum and will improve by time. And before it was pointing out of the acetabulum, so it would get worse by time. So that's a very important treatment in children below age 6. It's a treatment that many doctors around the world do. Most do it with an open release. That means they make big incisions, they release the muscles, and we do the same thing percutaneously. So there's less scarring and less pain. And as you see with your son, he's already playing and having fun and is really relaxed, and his legs are abducted. Yeah, so he couldn't do this before. So he was always scissoring. Okay, and it's very important that there is less tension, because before the surgery there was a lot tension pressing on the hip, which means it tended to be pressed out of the socket. And now it's relaxed, so it can move inside the socket, and so the development of the bones is much better. There is a good impact on this hip development as long as children are below 6. So usually it's the recommendation to do soft tissue release in any kind. So we prefer the minimal invasive kind, and then see how the hips develop. Hips grow slow. They only grow fast when your child is a baby, within the first year, and then it slows down and develops very slow. And but it still grows and changes its shape until 6. After that, the development is slowing down again, and you need to do other things to do the correction. But there are some options we use that are minimal invasive too, so children have less pain and they can move. It's very important for children with cerebral palsy that they learn to move. So every time of rest, any restriction of range of motion is bad. Yeah. So if they have their own restriction because muscles are short, they can't learn to move. So we release the muscles that they have the chance to learn a normal range of motion. If it's only restricted and they can move, they can't learn it. Yeah? And even children that are hardly disabled, and where we see probably they'll never walk alone, I think they need to have this chance. The soft tissue releases have had bad recommendations in the last years, because it's a risk to do it in children that are able to walk, because it depends on the technique you use. Some kind of soft tissue release make muscles weak.
And they lose food.
So they lose power, and it's more difficult. But we found with the minimal invasive technique we use that there's nearly no loss of power. So the children have still the power they had before.
Okay.
And even because they can move their muscles, they train them better than if it's restricted. and so they even gain muscle power. And we see this in children that are able to walk. They really walk longer, they make bigger steps, they are faster, so even they improve with this minimal invasive technique.
Super.
Hmm?
Good. So let's see how VL is done.
Yeah, so as we have a first result of directly after surgery, and we'll see the X-ray in 1 year, and then we'll see how the muscles improve and the hips improve. It doesn't make sense to make X-rays more frequent. It doesn't.
So this is enough, and now 1 year.
1 year.